be going live in just a minute, so feel free to start.
Good morning, everyone. It is August 27th, 2024. It is 8:01 a.m. I would say I'll call the meeting to order, but we don't have a quorum. So what we're going to do this morning for the Board of Health, my name is Deanna Diamore, I'm the Health Director in Norwalk. We're going to have the meeting, but it's not going to be a formal meeting with a quorum, and we're going to be voting. But we have some great updates that we wanted to get out there into the community. So we are going to start the meeting at 8:01 a.m. Present, we have board members Frank Ehrlich and Norman Weinberger. We have Health Department staff members Megan Fogno, Aniela Fignon, and Brian Weeks. So good morning, everyone. The first item on the agenda was approval of the minutes, but we are going to push that to next month. So when we have a quorum. The next update is epidemiology updates. Actually, before we start, Aniela, I see that Dr. Reed's on. If you could move him into panelist when you get a chance. And Dr. Reed, it's not going to be a formal meeting because we don't have a quorum, but we're still going to give some updates. All right, and Brian, it's all you. Good morning.
All righty. Good morning, everybody. So it's going to be a lot in terms of coverage, just because Deanna discussed covering a lot of the CDC Health Alert Network messages, as well as the CTDPH health advisory messages too. So again, this is going to be just a superficial overview. More so just talking about what just the current item is of interest relative to the alert. It's not going to go into a full in-depth kind of exploration of these different diseases and conditions, because some of them are novel, just because that would take up like the whole meeting and maybe more. And so with that said, I'm going to start off with our favorite thing, respiratory viruses, just to kind of do an update on that. So let's see, hopefully this shares correctly and my Zoom doesn't crash, because that sometimes happens whenever I do Zoom shares as of late. But yeah, long and short of it, what you should see on your screen is the updated CDC respiratory illness data channel. So this is kind of a new page, with a little bit new infographics and interactivity. And so long and short of it, it's just another ability for somebody to put their state and then also their county, and to kind of see a summary of what's going on relative to respiratory virus activity. So I already plugged in Fairfield County here. And as you can see here, overall respiratory virus activity in Connecticut is minimal. But then the wastewater viral activity in Connecticut for COVID-19 is very high. And then in terms of emergency department visits in Fairfield County, COVID, flu, RSV remain at no change. Then there's a nice little summary for, just at the national level, along with how to protect oneself, as we're very familiar with that. Regardless, just kind of mixing the data together, this is kind of one of the other channels or virus activity levels, visuals that we kind of looked at in the past. And again, this kind of is another way to look at things in greater detail. And so you can see it by state, looking at the respiratory illness activity. So this is looking at syndromic presentation. So again, fever and other kind of syndromes that present when somebody typically has any sort of respiratory virus. Relative to emergency department visit data. And so you can see here, generally speaking, most of the country's still at a lower level of respiratory illness activity, but the Southeast, you can see, is a little bit higher than the rest of the country, and also Alaska a little bit higher. And so it's just something to keep in mind, especially in terms of travel, as everybody's schedules are settling down now and going back to school or regular routine schedules. So with that said, kind of again, looking at the actual visualizations for this for Fairfield County, emergency department visits for viral respiratory illness, you can kind of see, just kind of like what's going on in a bigger contributor. You can see COVID-19 is the primary driver as of late with recent data, followed by, influenza and RSV, but more at baseline levels, which is, again, good to see. And this is what we typically see near the end of August, the beginning of September. Keep in mind with this week of August, this is the first week that typically is, respiratory virus season, especially flu season. And so we're kind of just starting the new season for 2024, 2025. And then with that, zooming down to the wastewater trends, just so we can see a more detailed visualization here for the country. This is based upon region. You can see the highest has been in terms of COVID activity, the West Coast. You can see a little dip right now, but again, as we see the data kind of develop, it could be just that, it's dipping a little bit, but it's going to uptick again. We have to kind of wait and see what the presentation is. But regardless, you have the West Coast the highest, South, and then you have the Midwest and the Northeast, kind of at similar levels. But the Northeast, as you can see, the incline here is a pretty steep curve. So we have the most indicated upward trajectory compared to all the four regions in comparison right now. So just keeping that in mind. And wastewater monitoring is going to be a better indicator what to expect. One, it's a lot quicker than emergency department visits because, again, somebody's got to get ill enough to then go to the emergency department to then be counted in the data. And the other kind of caveat with the emergency department data is that it's a limited number of hospitals that are reporting that data now. Because, now that we're past the COVID-19 public health emergency, not many hospitals are required to participate. And so it's a little bit more elective in terms of them supplying this data. But the wastewater monitoring, though, is still something that's, being maintained, still being funded, and much more thorough and reliable in terms of indications. So again, it's a better idea of kind of what's going on. And so right now for the Northeast, we're definitely on a steep incline in terms of activity. So just kind of bracing ourselves. And we typically see this as people's schedules settle down with COVID-19, because now you got all these kids going back to school, interacting with each other, and then they're going to go back to the household. And so it's just something very much for us to be mindful of. And again, just really quickly, just as a refresher, because I don't want to take too much time because I'm already talking so much. Again, we have, the strategies to address respiratory viruses, right? So the immunizations, because there's immunizations for COVID-19, for influenza, for RSV. There's the hand hygiene and respiratory etiquette, right? Coughing into and sneezing into your elbows, things of that nature. We want to just be mindful of that, and hand hygiene, especially hand washing, is going to be very important. Air filtration and fresh air where possible. Obviously, there's the treatments for, COVID-19, influenza. So those are also very helpful mitigation strategies, especially following up with one's physician and getting tested, right? And then staying home and preventing spread is also a very, basic common sense strategy that's very helpful in terms of, especially as we get further into the season. And then those additional prevention strategies, should somebody, should activity be high with respiratory virus activity, or if, again, somebody around you or yourself, obviously, is presenting or, presumably presenting with the respiratory virus, there's the masking, there's the distancing, and obviously, especially the testing. So again, if you suspect that you may be ill with the respiratory virus, coming down with something, stay away from others. So stay home, wait until your symptoms are better and you're fever-free without any fever-reducing medications for 24 hours. And then follow these additional precautions for 5 days, which is, again, is that masking, the social distancing, and additional testing. So just not to beat a dead horse, so to speak, because you guys heard this many a time, but, just as a refresher and a reminder. And then also, just as a quick thing, if you go to actually covid.gov, these rapid tests that were readily available in most of the other seasons for COVID-19 are going to be made available. So, individuals could then order these as well as they have done in the past to their postal mailing address. And so that's also just a great resource that's going to be coming out. So definitely keep an eye out for it. So it's coming out at the end of September here, as you can see here. So really great news. So that is just the general respiratory virus season from what we typically see in terms of COVID-19, flu, and RSV. And so what we're going to jump into now is some of the CDC Health Alert Network messages, which are pretty important. And so we'll start off with, just because it's in a similar vein, the human parvovirus. So this is something else you might not have heard about much in the news, but it did make it to a Health Alert Network message August 13th. So human parvovirus B19, it's another respiratory virus that has been seeing activity picking up in the country. So the CDC has sent out an alert about it. And so, it's important, especially with younger children, in terms of transmission with, in a daycare setting or a school setting, things of that nature. Just that, this is circulating and it can be a risk for these children, for also adults, especially in terms of immunocompromised state or immunosuppressed state. Pregnant women also are susceptible. So it's important to be mindful of this. And so there is often a characteristic facial rash that presents with in children for parvovirus B19. But yeah, nonetheless, what this message is from the CDC is just an alert to clinicians and healthcare providers in general, just to make them aware of what's going on, what they're seeing in national trends. So just kind of adding to that message of what we were just talking about. And then along with that, there was also a CDC HOND for measles. And so there's like a million here. So apologies, or actually a state health department health advisory relative to just measles vaccination. So kind of in a similar vein in terms of a very highly transmissible virus. Keep in mind, measles is one of those viruses. If somebody is presenting with the illness and they're infectious, you know, and there's 10 individuals in a room, 9 out of 10 are going to get infected. You know, obviously, unfortunately, there's a vaccine for it, very effective. It's just important that everybody has it and they're up to date with it. And so, you know, just again, there's a state health department message about anybody that's doing international travel 6 months and over to get this vaccine if they haven't gotten it and completing the series for it. This is really important because there's been a lot of outbreaks and clusters and exposure scenarios related to measles on the international scale, and has also occurred inside the United States. So just want to hit that home as well. So in terms of vaccination of what we do have vaccines for, like we were talking about the respiratory viruses, along with measles and things of that nature. And so, you know, now I'm going to shift gears a little bit in terms of kind of talk more about vector-borne disease, because that's still something we want to revisit. We're still in the season, even with the weather slightly cooling down, you know, in the last month or so. And so with that said, we'll start off with the Connecticut Agricultural Experiment Station data. These are the guys that do the surveillance for mosquitoes and mosquito-borne disease. And so what you see here, just quickly pulling up the data from up to August 19th, Norwalk has 2 sites and in total have 11 West Nile virus positive mosquitoes that have been detected. And so the majority at Rowayton School site, but also the Cranberry Park site. Helix pipiens is one of the, you know, which is one of the most common mosquito vectors in terms of transmission, you know, feeding on birds and things like that nature, is, you know, the largest volume in terms of that presentation. So not to keep going into that, but then, you know, switching gears, you know, here's a nice map visual, kind of all the activity for West Nile virus positive mosquitoes in human cases. And so New Haven County has had recently 1 human case that hit the news in this month. Again, you know, the West Nile virus activity, as well as we'll talk about the Triple E activity, has been earlier in the season than typically seen. So that's really an important point, is that, you know, this is kind of a rough season relative to mosquito-borne disease and mosquitoes in general. So just because the weather has been so great for, you know, in terms of them, you know, expanding their territory for breeding because of the heat and then also the moisture that we've just been seeing. And so just being mindful of that. And you can see how lower Fairfield County is kind of ground zero for a lot of those West Nile virus positive mosquitoes, even though New Haven County was the first to present with a human case. And so this is kind of a newsletter from DPH about that. So again, not long ago, August 16th is when they shared that. And so, you know, there's a lot of kind of basic, you know, kind of reminders in terms of how you protect oneself. You know, especially we had to kind of get through probably October, if not potentially November, depending on how the weather is. Because again, we had a mild winter, which is also partially a contributor to why mosquitoes are doing so well this season. And so if we have a mild winter again, you know, that will, you know, allow mosquitoes to really kind of still hang around much longer than we typically would hope for, right? And so again, just limiting that exposure, you know, using the, you know, insecticide, you know, such as permethrin in your clothing, you know, again, any sort of, you know, insect repellent, mosquito repellent, especially containing DEET, so DET, picaridin, IR 350, 3535, oil of lemon eucalyptus, PMD, you know, a lot of different chemicals, but just making sure you're using one that's effective and proven to be effective at the right concentration, safe to use, obviously, on your skin and your clothing to protect yourself and mitigate that risk of mosquito biting. And so, you know, just a bunch of other things also to reduce the territory of mosquitoes. You know, again, any standing water is the biggest thing, is just making sure that doesn't collect anywhere. And, you know, typical example is like tires in somebody's backyard, or like trash can lids, or, you know, again, you know, city water and bird baths, making sure that's changed out weekly so these mosquitoes don't have an opportunity to lay eggs and then grow and then, you know, kind of expand their territory once more. And so, you know, just kind of like those basic things, just as a reminder, not to, you know, state the obvious for you guys. But then also along with that, there's the Triple E side of this, and Triple E is much more concerning in terms of its morbidity and fatality risk. And so it's really important to keep in mind that we do have Triple E presenting this season, again, earlier than usual. As it typically presents, it comes from the eastern part of the state, and it's definitely showing here. And you can see there's a large number of these mosquitoes testing positive for Triple E. And it does make its way westward. And so again, since we have to make our way through what's presenting as, again, an earlier season, and we still have, a couple months, a few more months to go, they still have opportunities to further transmit and, make their way towards the western part of Connecticut. And so there's also been alerts going out from Massachusetts and, other states as well, just mentioning this because, again, it's not great. We have time against us as well as just the number presenting and, the weather and climate situation that's kind of contributing to this as well. And so that's that. And so in a similar vein, again, with vector-borne disease, for one, there was a CDC HAN, only a couple of months ago that was talking about dengue virus, which is also transmitted by mosquitoes. An increase of that, especially related to travelers, outside the country, especially more into the Caribbean area or more tropical destinations, and then presenting here in the United States. There's also just been transmission that has occurred, even community level, relative to parts of the United States, more so like Florida and Puerto Rico, but other states as well. And so with that, there's also the Arapush virus, which is typically more endemic in kind of like the Caribbean or Central and South America area. But unfortunately, it's also now presenting in travelers to these areas that are coming back to the United States. And so what's important here is clinicians being mindful of this and aware of this virus because it's not as commonly understood. And people are aware of it. But yeah, nonetheless, this is another kind of, vector-borne disease that can also present similarly to dengue fever, the dengue virus with the fever and other kind of, other manifestations and presentations. But anyways, long and short of it, it's just this is circulating as well on top of everything else. And so really quickly, for those that are not familiar with it, clinical presentation is commonly mistaken for other viruses like dengue, chikungunya, Zika viruses, malaria. There's no vaccines for Arapush virus. It's typically spread by the bite of infected biting midges. Some mosquitoes can also transmit the virus as well. And so it's just, this is just some basic information so people are just aware of it. But again, it's just that mitigation strategies we're talking about with mosquitoes would definitely apply, as well as just kind of common sense, in terms of when traveling, protecting oneself and applying those prevention measures too, because, there's a greater risk of that exposure. And then be mindful upon returning if you're presenting in any sort of way that would be suggestive of Arapush virus, which typically is an abrupt onset of fever, severe headache, chills, myalgia, and arthralgia. And so, not to keep going on about that too. And so with that, finally, we'll go into the CDC Health Alert Network message about Mpox, or formerly known as monkeypox. Again, this is, from August 7th. This is important because there has been that uptick of it. There's two different clades of concern, clade 1 and clade 2. Clade 1 is especially the bigger concern, given its higher morbidity and mortality risk to humans. Clade 2 is what we were dealing with in 2022 and 2023 with the Mpox outbreaks, and it's still being transmitted internationally, including the United States. But clade 1's the bigger one now in terms of also keeping an eye out for it. And so long and short of it, just to kind of give some context, clade 1 unfortunately has been detected outside of where it's typically endemic in Africa. It's also been detected in Sweden. They had a human case, and then also in Thailand now at minimum. And so we should anticipate it potentially could be transmitting in other countries outside of typically where it's endemic. So it's something just important for us to keep in mind. Because, it's still kind of an unknown in terms of how it presents in the United States. And, again, if it's going to be, clusters or an outbreak situation like we were dealing with clade 2. And naturally, we don't want to find out, but it's important to kind of be mindful of that. So looking at some indicating data, this is from the New York City Health Department, just to give us an idea. This is clade 2, right? So this is the slightly milder version of, Mpox. But nonetheless, you can see kind of how we peaked in activity relative to April of this year. But it's been the highest it's been even compared to, say, 2023. And again, given the proximity New York City has to us, it's a very good indication of kind of what's going to be going on in the rest of, this region in the Northeast here. But the activity is still pretty high in terms of even the more recent data here that goes into July and August. And so just want to be mindful of that, you know, Mpox is still, you know, spreading in the community. As I always like to qualify it, summer of love. And so just people being mindful of this in terms of the presentation of symptoms, seeking treatment with their healthcare provider. You know, Mpox presents with this typically kind of, you know, kind of vesicular rash, so to speak, that presents on most of the body. And so, you know, typically that's the kind of the trigger for somebody to go to their healthcare provider to get a differential diagnosis to determine if it is Mpox. There are individuals at greater risk of presenting with Mpox, you know, in terms of, you know, very close contact, intimate contact, sexual contact. And so there's actually a vaccine 2-dose series that is helpful in terms of mitigating the risk of morbidity and mortality. It's called a Jynneos vaccine. And so individuals can go seek that out using the CDC. They have a locator. And so, you know, this is some more background about the virus in itself. But, you know, in addition to that, you know, just the vaccine people can get. So a 2-dose series that provides the best protection. So again, completing that. So get the vaccine, especially somebody that's, you know, men who have sex with men, predominantly, or as well as in terms of any other kind of, you know, highly risky sexual activity. Those individuals will be eligible for that vaccine. They can get it using the CDC vaccine finder. So this is one version of it. And pretty straightforward, mpoxvaccine.cdc.gov. So an individual can find a clinic that offers it and follow up with them and get that 2-dose series, which is phenomenal. And then along with that, there is also a treatment, you know, that is available for somebody that does test positive, especially based on their health condition. You know, they will be prescribed the treatment. But nonetheless, the vaccine is really, really a great resource, along with the fact that, you know, people are just aware and practice, you know, the common sense prevention measures in terms of prophylactics and things of that nature that will help mitigate, you know, the risk of transmission and picking it up. So you just want to mention that just because, especially with Clade 1 now potentially a risk factor on an international scale, even though it's low risk, given that it's only a small handful of countries that are presenting right now, still common sense rules here in terms of just protecting oneself and protecting others. So there is that. And then also, I think actually I forgot to mention about going, you know, not to change gears again, but going back to the respiratory illness situation, right? We have pertussis. There was also a health advisory from the state health department on August 7th about pertussis. And so typically it presents with, you know, pretty severe coughing fits, generally speaking. And so it's just really important because it's a bacteria. So there's antibiotics for it, getting treated early, but also there's a vaccine for it too. And then it's most important that everybody get up to date with their vaccine. And so there's a great visual from the CDC here. There's the DTaP, Tdap vaccines for the different age groups and, you know, when the eligibility would be. But, you know, this is just really important that everybody, you know, get up to date with this as well, just because, you know, there are clusters and increased activity relative to pertussis transmission. And so it's not really a pleasant cough either. And, you know, coughing fits could last very long, for a very long duration. So just mitigating that is, you know, the name of the game. And this is a very well-established vaccine. So it's really important that everybody just stay up to date with that. So anyways, that was a lot of rambling, but in summary, with the CDC Health Alert Network messages, you know, we have a lot of different things we need to keep in mind, but there's the Arapush virus. There is, you know, there's also the Mpox virus as well that we just discussed. Along with that, you know, also just kind of the human parvovirus B19. There's also the respiratory virus situation, which we would anticipate, again, as we kind of now just newly enter the season. Over time, it's going to be increasing, but the activity is still already high. And you saw that kind of, you know, pretty steep curve for the Northeast. Along with that, you know, you got, you know, just the pertussis advisory from the state health department, and then also the measles vaccine for international travel. So vaccines are also the name of the game. And then be mindful and following the prevention strategies for vector-borne disease, you know, especially mosquitoes, in terms of just being mindful of West Nile virus and Triple E, even like the dengue fever we were talking about. So it's really important, especially that applies not only here in the country, but also in terms of travel. So I'm going to stop rambling because that was 25 minutes almost of me talking. So, you know, thanks everybody. If you have any questions, let me know.
Thank you so much, Brian, for all that information. I see Frank has his hand up. Frank, do you have a question or
Yeah.
comment?
Brian, what what's the Department of Health planning, or if they're not planning, to do with the new CDC COVID vaccine?
I'll speak very briefly about it, then I'll hand it over to Deanna or anybody else. But in terms of the state health department, I mean, there's a concerted effort in terms of our department, even, obviously ordering the vaccine and going to be distributed amongst the community. But then the state health department, there's obviously been campaigns in terms of, this is the timeline to really start getting the word out there. So that's a very general overview on my end. I'll kind of hand it over to somebody else from, our end in terms of kind of explaining it some more, because that's not quite, in my area, but yeah.
Thanks, Brian. So since, the privatization of the vaccines, last year we ordered a small amount and we vaccinated small amounts, but we're trying to see like how we're best utilized in the community, because most people will go towards, pharmacies and others or doctors. But we have been looking into, Brian has been thinking through like, nursing homes. Do they have a need to assist with, assisted living facilities with skilled nursing with, their staff? Like, is there a role for the health department? We've also thought about, congregate settings. Is there a role for the health department? So that's sort of more on the line that we've been doing, rather than like doing large community clinics. We're sort of phased out from that for COVID. It's more about of like having a small amount of doses available for people that want it, who are in our clinics, for, who are in there for other clinics, and then thinking through some more of the congregate settings. How do we, fill the gaps of access?
Has there been any thought on how to best I'll use that word, it's not truly advertising, but advertise where the citizens can go that the Department of Health thinks is safe and good? For example, one of my neighbors did not want to go to CVS to get their COVID vaccine during the peak of COVID because they didn't trust that they were getting it safely.
That's
So
a
we-
marketing problem. I don't see any reason why CVS would be any less safe than other areas, unless there's reporting I'm unaware of. I mean,
Yeah.
we've gone from big clinics to distributed in the community, widely available, and that's a much better model for people to get vaccinated, I think. I just wanted to comment about COVID. You look at the numbers and they're very low, but these numbers are based on ER visits. My own personal experience, and Deanna will confirm, is it's widely circulating. We were to have a party last weekend with a family from Greenwich, from us in Southport, and some members in Darien. And I had it, my wife had it, people had it in Greenwich and Darien, independent of seeing each other. So it's widely circulating in the community, and it's just not being reported.
And that's why the wastewater surveillance is so key.
Absolutely. That's and you looked, it was extremely high, and that matches what you're seeing in the community. And people aren't terribly sick with it. It's unpleasant, but it's not a more mortal thing as it was in the past.
I want to just add to what Frank was asking about, where to go. So we have staff that can assist people with, finding where they can, appointments. We've always had like a vaccine assistance. A lot of our staff help. We don't get involved in, which place is better than the other to go. It's more about just access and where they can get it in the community. So we try to link people up to, where they can get it, that it's most convenient for them. And I don't know if Megan, you want to add, because we do still do a lot of vaccine outreach. So.
Yeah, I was just going to say, I was going to share my screen too. Sorry for the sun on my face. We did actually recreate some information flyers that our community health team share when we're out in the community, and find a COVID vaccine near you. I can share my screen and show you guys We do have it in multiple languages, and so we actually had it printed and it's being currently used in the community. So this is what we have. It's a QR code, and we also share our vaccine information line, which is, folks can call if they're having issues or, challenges finding a vaccine. We're able to help them and assist them that way. So this is, was just updated in May. And I think that's what
Thanks,
Brian was
Megan.
going towards. I think
Yeah.
that's the vaccine same thing.
Thanks, Megan.
Mhm.
Well, thank you, Brian, very much for that really thorough presentation. You covered a lot in a short amount of time, so thank you. Any other questions? All right, hearing none, Megan's gonna give some updates about more about immunization outreach.
I was just fixing the shade there so I wouldn't be blinded the whole time. I can't see, you guys can see my screen fine?
Yep, looks great.
So like Brian mentioned, pertussis, also known as whooping cough, we're hearing more about it out in the community. The state has released some more information about it. So I just wanted to share what we've been doing in our community around this. And so as you guys probably know, pertussis, also known as whooping cough, is a highly contagious respiratory infection. Luckily, this disease can be prevented, and you can gain protection through vaccination, like Brian mentioned as well. Whooping cough is particularly dangerous to infants, so newborns and children under 1, as they're not fully vaccinated until after 1 years of age. So besides the cough that you would start, it's kind of like a common cold, it seems like, but the cough persists. And then in children and some folks, they start whooping from coughing so much. It's a really, really nasty disease for children. You can also have runny nose and congestion and sneezing. In infants, it's especially dangerous because they're coughing so much they can't breathe, and so they're gasping for air. They can also end up with cracked ribs. They can end up vomiting and inhaling that. So we really want to try to protect infants. And so being that they can't get vaccinated until a little bit older, we really want to put a cocoon around them of protection. And I'm going to talk a little bit about those efforts. So this is just some of our social media coverage that we've been promoting. That one slide that Brian had up of the different age groups of when to get vaccinated. So the vaccine for children is DTaP. That's protection for diphtheria, pertussis, tetanus. And then for older folks and older children, it's Tdap, the same thing, tetanus, diphtheria, and pertussis. And so we have targeted messages depending on the age group. And so older children from 11 to 12 need that booster dose because they wouldn't have had a vaccine since they were younger, and protection can wean off. And then you also, if you're a pregnant person, you want to get that Tdap vaccine during each pregnancy, during the 3rd trimester of pregnancy, to really give some protection to the baby after they're born. And then anybody who's taken care of or who's going to be around a newborn or an infant really wants to get that additional dose. And so that's parents, grandparents, caregivers, daycare workers. So we've really encouraged all folks, if you're around a child, to get that additional dose. And so these social media coverage were translated into Spanish as well. And then a little bit about the cocooning program. And again, this is like to put a cocoon around the baby. This program actually started 2010, so 14 years ago. And so this was an initiative through the state health department. And so the Norwalk Health Department really took it on and went with it. Through our IAP program that Pam Bates runs, we started promoting the importance of getting vaccinated for pertussis, and then really encouraging folks to get it. this is a voucher that we had a different voucher that we actually just updated this one. But we would give this out in the community. We also give this out through our WIC office and just let folks know that they could come to the health department to receive that vaccine for free. The vaccine is given through the Vaccine for Children's program at the state. And so local health departments and other providers can order the vaccine and then distribute it within their clinics to the community. And so again, we've been doing this for a while, promoting this vaccine. I think just, you know, seeing the disease more prevalent in the community, we've just kind of revamped some of our promotion around it. Again, these vouchers are already in the community, and then we also give them out in our WIC office. If somebody is in our WIC office for an appointment and they need a Tdap vaccine, if a provider is available, we will vaccinate them right there during our clinic. If not, we'll make appointments for folks to come in. And so if anybody knows anybody who needs a vaccine, you could just call our main number there and we will schedule an appointment for you. And then lastly, these vouchers are also going to be included in the hospital education and outreach efforts at both hospitals, Norwalk and Danbury, that the IEP program covers. But especially in the Norwalk Hospital, those vouchers will be included in those educational packets that we give. And then this right here is just some new gear that Pam and her team have put together. These are wet bags, so you can put dry clothes in them. And then if you need a change of clothes for your baby, you take out the dry clothes and you put in those wet clothes, and then this will prevent anything else in that diaper bag from getting wet. There's also a hairbrush, a comb, nail clippers, a baby spoon, and a bib, a silicone bib. So these are just some new gear that the IEP program has been able to give out to the community. And I think that's all I have. If there's any additional questions, let me know.
Thanks, Megan. That's great. I love seeing the pictures of everything.
Cute stuff.
Any questions for Megan? All right. Well, thank you. I wanted to share as part of my director's report something about immunizations. So I will hold that for like 2 minutes until I get there. But I wanted to highlight for the community health assessment, we're in the middle of conducting the community health assessment, in partnership with Norwalk Hospital, New Vance Health. And right now we have a community survey that's posted, and we have a link for it on our social media. It's about a 10-minute survey. It's quick. It's available in English, Spanish, Haitian Creole, and Portuguese for community members to reflect on, what their, health status is, what they think the most important needs are in the community. Megan and her team and Teresa and the community health team have been promoting the survey out at public events. They've attended about 10 public events where they've promoted the survey over the past few weeks. They posted the flyer at different 12 different community locations, distributed them to individuals. I'm really just trying to get a great sample size for Norwalk. So I just wanted to highlight that, and that if we can circulate that amongst all the board too, so you can forward it on to anybody you think. But we're just trying to get the word out about the survey, and so we're in the middle of the data collection phase for the community health assessment. We're still also working with Data Haven. They're doing the telephone survey, but it's a great this go around for the community health assessment. The hospital and us, we're doing surveys for those who work in community-based organizations, community members, online, and then also doing the telephone surveys as well. Just wanted to highlight that for the community health assessment. I'm going to move the strategic plan implementation agenda item to next month when we have more board members present to discuss that. And then for the director's report, I wanted to highlight the childhood immunization rates have been updated and have come out again for the state for our area. Pam has been on in the past to review the IEP program, and so we can have her back on again in a future month. So I just wanted to to share that amongst children born in 2021. We've been notified that our area is once again the highest in the state for childhood immunization. So 87% of the children in the Norwalk area have received all the recommended vaccines by their second birthday. So just wanted to share that great news with everyone. You can see all the incredible work of Pam and Sarah in the IAP program, and then Megan and others support them. I mean, really the whole department in certain ways helps out. We all work together to promote the vaccination. All the preventable disease division, Darlene, and I mean, I could name everybody pretty much, but so I just want to thank the team and the staff and obviously all the pediatricians and the providers who are doing great work to get children vaccinated, all the nurses, everybody out there. So great news. And we issued a press release too that was released. So hopefully we'll get some coverage on that. Great news. And then the other thing I wanted to highlight was, we missed a meeting last month because Brian and I attended the National Association of County and City Health Officials annual meeting. Brian presented on a community health and well-being profile that he developed to make, as a, kind of supplement expansion of our community health assessment to make data more readily available to the community, more dynamic, with his dashboard that he's presented at the board meeting before. And so he got a lot of compliments, a lot of people, a lot of questions. He did a really phenomenal job reviewing it. So it's great to have Norwalk highlighted, have his work highlighted, and really shown as, a best practice for the nation. So that was really incredible. And then I was given the opportunity to speak at a session to talk about, highlight some of our uses of technology in public health practice and what value that's brought to the health department. So I was able to share, our staff's work and Brian's work and his team. I highlighted mostly, the COVID-19 data hub, the establishment of the portal for folks to report their self-tests for COVID, and if they want to request for guidance for illness, outbreaks, and cluster situations. The work to track outreach efforts that Brian worked with Megan and her team on for the CAP program. The COVID immunization. So a lot of great work. So people are very interested in that. And they're also really interested in how we in Norwalk have built the infrastructure to advance the use of technology. And so, a lot of different, I talked about how, the Epi and Informatics division, I talked about the Office of the Director and the staffing, and how we've, supported technology within the health department over the years. And so a lot of people, again, were really interested in how we've done that and how we've been able to do that in Norwalk. And, that's because of this very forward-thinking Board of Health that's always been promoting technology and data and the importance of that. And of course, the mayor's support as well, and Lamont's support as our Chief of Community Services. So that was great too, to be able to give that opportunity and just to talk about how great Norwalk is. So wanted to highlight that as well. And I don't think I have anything else. Is there anything else before we wrap up? There's nobody here in the attendees, so we won't have public participation. All right. Well, thank you, everyone. Thank you for the great updates. Thank you for the great questions and discussion. And we will see you next month.
Thank you.
Thank you.
Have a great day.